Good morning, everyone. I'm happy to see a lot of people here, and I'm very happy to be invited for this meeting. My hot topic currently is ADHD and sleep, and what sleep debt might implicate for health in patients with ADHD. And of course, when a sleep problem is as prevalent as it is in what I will discuss, people ask, what's the chicken and what's the egg? Pointer only. How do I? Oh, here. Yes. So is it that ADHD causes sleep problems because of hyperactivity and racing thoughts at night? Or is it that sleep problems cause ADHD because when you're exhausted after a night of little sleep, your cognition may suffer? Or do both problems interact and influence each other? Or do ADHD and sleep problems have a shared underlying etiology? And the blue ones are the most probable ones, and I will explain to you why I think it is. What's known about sleep in adults with ADHD? They have an increased prevalence of a late circadian rhythm. That means that there are late sleepers, evening-type persons in 78%. It's almost everyone. It's very deviant. It's normally in the population 20%. 20% of the population is evening type, and here it's almost 80. It's very, very interesting. It means that it takes longer to fall asleep, longer sleep latency, and it means that you have a shorter sleep duration because you have to get up in the morning if you want to go to school or comply to working hours. So the mean number of hours my patients sleep is 5 or 6 hours per night, and this on a chronic basis. A healthy duration is 7 to 8 hours. This leads, of course, to fatigue during the daytime in 62%, a variable sleep schedule because people try to cope for sleep loss, so they go to bed early, late, very late, and a normal time and everything in between. And this also induces several problems. In addition, there's to a lesser extent, restless leg syndrome and nightmares. What is a circadian rhythm sleep-wake disorder? What's it all about? We call it the delayed sleep phase type. It means that your chronotype, it is a genetic trait everybody has. Sleep rhythm is genetically based. You're a very late type. It's a chronic pattern of late sleep and preference for late rise because, of course, you want to sleep in if you have a lack of sleep during the night, leading to daytime sleepiness and or insomnia compensated for by irregular sleep pattern, dysfunctioning due to increased ADHD symptoms like inattentiveness and or social problems. And the main complaint people present is sleep onset insomnia. We studied 7 years ago already the characteristics of 40 consecutive patients, adults with ADHD, with sleep onset insomnia and without. It took us a year to find 9 people without sleep onset insomnia, and we have 80 new referrals a month. So this is to tell you how rare it is that there's no sleep problem in ADHD. And what we surprisingly found was that the combined type in almost 100% suffered from sleep onset insomnia, but the inattentive type did not. So the sleep problem separated the subtypes to some extent. And from this day on, I started thinking, is hyperactivity in fact a way to keep yourself awake during the day? Because as long as you keep talking and moving, you can't fall asleep, can you? So it might be a coping style for sleepiness. If they stop talking and moving, they may fall asleep during daytime. We measured in this group of 40 patients the dim light melatonin onset in saliva. This means that you have a sword to chew on every hour from 9 to 1, and that you measure the level of melatonin in saliva. It's a reliable method. And we found the dim light melatonin onset to be delayed 105 minutes in those patients with a late onset of sleep. It was later than controls. We had healthy controls to compare with. It was their DLMO, their melatonin onset was around 9:30. This is a normal moment for the rise of melatonin, the sleep hormone. But in ADHD and sleep onset insomnia, it was 1 hour and 105 minutes later. This was highly significant. Also, between ADHD without sleep onset insomnia, it was highly significant. You must know that after the rise of melatonin in saliva, it takes still another 2 hours to really fall asleep. And so it means that if your DLMO is at 1 a.m., you will not sleep before 3 a.m. And this is actually the time that they report, that they can fall asleep easy. So we consider that the melatonin rise and fall, our sleeping hormone, can be regarded as the yellow sign. So the whole rhythm is delayed, shifted to the right. We also measured movement patterns using actigraphy on the non-dominant wrist. And this little apparatus measures every movement of that wrist during 24 hours, thereby showing the 24-hour movement pattern. So this is the night when you lay still and sleep, and this is the day with more activity. And here we see the normal controls and those without sleep onset insomnia are earlier than the ADHD. So the shifted to the right movement pattern is again those with the sleep onset insomnia. Another study comparing 12 adults with ADHD and 12 controls measured temperature. And we see exactly the same pattern. Also, the temperature profile follows a 24-hour rhythm and is shifted to the right to the same extent as the melatonin and the movement pattern. We also found that after DLMO, we measured DLMO again in this study. It took ADHD patients not 2 hours to fall asleep, but 3 hours. So maybe there's also a problem regarding the sensitivity to melatonin. Or maybe the levels are lower. It's very difficult to tell which level you should have because it's highly individually variable. But the sensitivity to the hormone might be decreased as well. When we saw these pictures, we realized that if these variables are all delayed, so sleep, melatonin, movement patterns, and temperature, what else will be delayed, and what does it mean for health on the long term? This picture shows the interaction between melatonin rise, this is the darker line, and the decrease of activity at night. Here you see the controls having the crossing of both at 11 p.m., so here they go to bed, and in ADHD it's after 1. So this is making clear that the interaction between the rise of melatonin and the decrease of activity at night. Well, now back to chicken and egg. This is a study by Martijn Arns, a colleague of mine in Holland, and he showed in 2013 that the light intensity might have something to do with the prevalence of ADHD, the distribution of the prevalence. And showing here the solar intensity, the red area being the Mexico and countries with a lot of sunlight. And here you see the same picture of America with the lowest prevalence of ADHD in the same area. You can easily see that those graphs overlap. This can only be explained by the influence of light, maybe not on ADHD directly, but on sleep rhythm. It means the stronger the daylight, the better your rhythm is. The more contrast between day and night, the better you sleep and know when you have to fall asleep. Your brain knows when to fall asleep. So it means that Scandinavian countries and our country, Holland, will suffer from a more vague difference between day and night because our light intensity is less, and maybe our night darkness is less because we use a lot of artificial light, don't we? And artificial light, I'm not joking, is really influential on your sleep pattern and on your health in the long term. I'll come back to that. So this is one study from my PhD student, Annette Bron, and she studied in a population study in the Netherlands, a NESTA study, whether ADHD influenced the prevalence of circadian sleep disturbances. We all know that in depression, circadian rhythm disturbances are also prevalent, and we wanted to know whether ADHD added any factor in that, and it did. So ADHD increased the odds for late chronotype by 2.6, regardless of after correction for depression and anxiety, for an indication of late sleep and for a shorter sleep duration, shorter than 6 hours. So it's really there. What about late sleep and mood? We know that late sleep and winter depression are connected in about 70%. So these disorders are both of a circadian origin. And it means that there is difficulty to synchronize to external cues, especially when they're weak. So the weak light is more difficult to synchronize with. We think, we know that there is a suboptimal melanopsin system in the eye in winter depression, in seasonal affective disorder. And we're now studying the melanopsin system in ADHD eyes, because I come back to that later. What's concordant in late sleep and winter depression is that we both treat it with light therapy that's both very effective and very quickly effective. So light, again, has a role in both sleep and mood in winter. The prevalence of winter depression is increased in ADHD up to 27%. It's our study, and it's 3% in controls. So it's almost 10-fold increased. How do ADHD and winter depression relate? This is again the same population study in Amsterdam in anxiety and depression people, and we controlled for ADHD, late sleep, and seasonal affective symptoms. Here again, we see that ADHD drives winter depression and late sleep, and these are the numbers for current depression and the other variables investigated. So ADHD symptoms are related to a later sleep onset time, to a shorter sleep duration, and both factors influence the development of winter depression. Now about health. Having such a prevalent disorder in both children and adults with ADHD, the late sleep, and they sleep short because they have to get up in the morning for daytime obligations. We must remember that short sleep has been associated with chronic disorders like obesity, diabetes, cardiovascular disease, and even cancer. And when I realized that this problem was this chronic in my patient, I realized they might be at risk to the same extent as night shift workers after 30 years of night shift work. And we all know that they have an increased risk of breast cancer, prostate cancer, and all kind of other chronic diseases. So from that time on, I never slept, you can imagine. Because I want to do something about it now that I know. But how? Another implication of late sleep might be late breakfast. Most patients with ADHD skip breakfast, and skipping breakfast on itself is a factor contributing to obesity, because it leads to binge eating later the day. But what if skipping breakfast is also related to the late sleep rhythm, leading to late appetite and late, everything is late, so also eating. And then you don't eat a proper breakfast, but you have breakfast with coffee and a cigarette at 11 a.m., which is no breakfast. It is 2 times an intake of dopamine. What they need, but not in this way. And if you don't eat, your attention suffers, and you will have a system breakup at 3. And then there's no proper lunch available, so you eat unhealthy snacks, which increase your weight. And if you eat not on time, your hormones and your enzymes are not ready to digest your food, leading to obesity. So if you eat late at night, you may have pre-diabetic glucose levels during the nighttime that are not reduced by insulin as it should. So eating on time, sleeping on time is really better than doing whatever you like. I'm sorry. So here we see, here we see the biological clock of the sleep. It directs the time of our fastest reaction, the greatest cardiovascular efficiency and muscle strength, the blood pressure, the temperature, the melatonin secretion, the bowel movements, the sleep depth. So all kind of physiological processes are timed and directed and regulated by the clock of the sleep. So if we mess up sleep, we mess up the body. And that's why I call my patients chronically jet-lagged, not only regarding sleep, but regarding physical ailments. Next question is, do they have more ailments? I can tell you yes. We showed it in a questionnaire study compared to controls. This is other studies from internal medicine showing that sleep loss causes control over appetite. Your leptin and ghrelin levels will change immediately. After 2 hours of sleep loss, your appetite for carbohydrates will increase. And we all know that from our own experience. But if it's on a chronic basis, obesity is your next step. Sleep loss has been identified as indeed a novel risk factor for diabetes too. This picture shows a study in normal adults, 6-year follow-up, showing the relationship between short sleep, normal sleep, and long sleep. And here you see that optimal sleep is 7 to 8 hours because both long and short sleep are associated with weight gain in 6 years, increased waist circumference, which is even a better measure of obesity, and a change in body fat. So 7-8 hours is really optimal. Here, this is a study about the health complaints of adults with ADHD, and we compared 200 patients with 200 controls, and indeed, they had more morbidities, complaints, and an unhealthy lifestyle. They slept later. They had sleep onset problems, short sleep, later mid-sleep, more variable bedtimes. It was related to winter depression and health issues in both ADHD and controls, but to a lesser extent in controls, and short sleep was indeed related to a higher BMI. So we repeated this question in the epidemiological study again, and this is not the this is a clinical study comparing obesity patients, controls, and adult ADHD, and we found that ADHD is the more severe impaired regarding short sleep and unstable eating patterns compared to both other groups. But obesity patients are in between. So I think this picture is rather complex, but I'll talk you through it. If we start with ADHD and late sleep, we know that late sleep is correlated with winter depression. Winter depression comes with carbohydrate craving in winter. Late sleep results in short sleep and in altered leptin-ghrelin ratios, leading to carbohydrate craving again. It leads to breakfast skipping, binge eating, obesity. These processes may be facilitated by inflammation and finally leading to these negative outcomes that we want to prevent. Now about cancer. We know shift work is considered, especially after 20 to 30 years, as carcinogenic, and sleep loss by shift work is associated with higher incidence of breast and prostate cancer. The reason why this is because melatonin is an antioxidant that protects our bodies from development of cancer, and here is a very hopeful sign of this, is melatonin an inhibitor of breast cancer. In animal and in vitro studies, it has been shown that melatonin has several activities in this regard, like preventing vessels to grow into a tissue, like preventing metastasis to happen, like repairing DNA damage during nighttime. So I think we need enough melatonin and enough exposure to melatonin during the night to prevent cancer to develop. So if we do sleep short, or we sleep irregularly, or we sleep during daytime in case of night work, our melatonin levels are not as good as they should be. Another carcinogenic factor, I'm not kidding, is light at night. For the same reason, light is the opposite of melatonin. It makes us awake, better than the radio, because it wakes up the brain. We need light to wake up the brain. But if we do it at night, our brain thinks it's daytime and starts all kinds of processes that belong to daytime functioning. And this is disturbing the sleep rhythm, disturbing melatonin production, because it has been shown when light falls into the eyes, your melatonin production stops at night. And then it takes some time to recover and to build up at enough level. So it's not good to fuzz around with your melatonin level at night. So if you need to go to the toilet, don't use the light. Many of us know that, because otherwise we won't sleep so well. But using screens in bed, television in the sleeping room, in the bedroom, it is not helpful, because it contains a lot of blue light, and blue light is the wavelength that's most effective in reducing melatonin production. So light is good, but only during the day. And my advice would be, let your day be bright and your night as dark as possible. What can we do about it? To fall asleep, a high dose of melatonin will work usually very well in people with a late chronotype. So 1 hour before the desired bedtime. But we're now studying a lower dose, whether it would be as effective, 0.1 to 0.5 milligrams, between 4 and 7. So this is a dosage that doesn't increase sleepiness immediately, but gives a signal to the clock for later onset of sleep. People who don't sleep using short-acting melatonin may sleep using Circadian. This is a registered long-acting medication, and it lasts 8 hours. It's very helpful for many ADHD people who wake up at 3 after falling asleep because their own melatonin is still not appropriately made. Even melatonin tablets may be sensitive to light and denaturate, so beware that you keep them dark. We can also reset the rhythm using light therapy. It's well known for winter depression, but we also use it for resetting the late sleep phase, and we're studying it now in a more controlled way. You can use a wake-up light, but it's usually not strong enough for ADHD patients to be woken up during deep sleep at 7 a.m. So this is the better one. It's 10,000 lux, 30 minutes, 5 days at least. But for sleep, you need 3 weeks of resetting, we found. This is the blue light one. It's also good. And this is something that you can use to paint the ceiling during night. And it's not a good lamp to look into, but if you direct it to the ceiling, it will work as well. So this is the cheaper solution for poor people. We're now studying the rhythm in ADHD by advancing the sleep phase and checking whether health will improve in the short term using all kinds of biomarkers like melatonin onset, sleep rhythm, cortisol, leptin-ghrelin ratios, vitamin B, vitamin B12, all kinds of markers that could be influenced by better sleep in the short term. And if we show that better sleep during 3 weeks using melatonin plus light or placebo, then we are in business, I think, to show that sleep loss in ADHD really is a negative effect for health that we can improve by resetting the sleep phase. To be continued, because these are only the baseline data that we now have, not the whole group that we want to gather. But we again confirmed the delayed melatonin onset, fragmented sleep. Look at this. You sleep late, but you also sleep less, 104 minutes, because you wake up during night. Cortisol seems delayed. The BMI was increased in 65% of people that were not really obese, and so on and so on. So there are several signs that they are indeed less healthy than you might expect. Yeah. Okay, this is another one that the light sensitivity of the eye seems also implicated in ADHD. People are oversensitive to light and wear sunglasses all the day for hours, even in winter. And this doesn't help to synchronize with the day-night cycle of dark and light. So we want to know what's happening in the eye too. We think melanopsin might be implicated, and we're now measuring the pupillary response to light in ADHD versus controls. Thank you very much.